Hello, everyone, and welcome. Today, we are talking part 2 of our 3-part series on sepsis in babies and children. My name is Sarah Hunstead. I am a paediatric nurse, mum of 2 gorgeous girls. Well, occasionally gorgeous. They can be rat bags as well sometimes, but anyway, that's another story. And I'm also founder of CPR Kids. And today, I am joined by Amanda Harley, who is, and I'm going to read off your title off my notes here, Amanda, because I don't want to get it wrong because it is a rather fabulous title. You are the Paediatric Sepsis Clinical Nurse Consultant for Children's Health Queensland. Have I got that right?
Pretty 99% right. I'll take it.
Okay, good. Okay, all right. That's not too bad. But before I get you to tell us a bit about yourself, I'm just going to let everybody know what we're going to be talking about today. And while I'm doing that, guys, if you can give us a thumbs up or a wave, just so that I know that all the technology is working well. Because a couple of Facebook Lives ago, I forgot to turn off mute on my microphone. And not only was that really rather silly, but I forgot to look at the comments and didn't realise that it was on mute until it was about 7 minutes in. So we're not going to do that today. Thumbs up or whatever you'd like. Say hi, tell us where you are just in the comments. But we're going to be talking about basically what sepsis is. So your role as a parent or carer, family member in identifying, the signs and symptoms and what role you have in that. And certainly what the risk factors are and recognition and prevention as well. And we've also got a fabulous website from Children's Health Queensland that I want to show you afterwards as well. And we're going to put some resources in the comments too. So please make sure that you tag anybody in the comments below who you think will benefit from this life-saving information. So I've chatted enough now. Amanda, tell us a bit about yourself.
How long do we have?
We have quite a while. We have a while.
I don't want all the information on this, let's be honest. So my first disclaimer is that I am historically an emergency department nurse. So I'm one of those people that may look a little bit grumpy at 4 a.m. when you come in to the emergency department, but I want to be very clear that we are always there to help, and the role and the information you tell us is really, really important when we care for your child. So that's my first disclaimer. Now, with the emergency department background, I'm inherently a fixer. So what I like to do is I like to fix things. I like to solve problems. I'm yet to find, sometimes I can't solve all problems, but I like to try, most certainly. So with the role that I'm in at the moment, and that is essentially, I think, why I am so interested in paediatric sepsis and why I'm so passionate about it, is because paediatric sepsis is such a complex condition. But what we're learning is that it really is a role that everyone plays a part in. And I'm really blessed and feel very privileged to come and speak to you guys all here today and talk to you about the role that you can really play in paediatric sepsis recognition and escalation to health services. I'm that interested in paediatric sepsis that I also decided I would do a PhD in it, because I've got a lot of spare time. And I thought, you know what, why not go one step further and read some more textbooks in my spare time?
Yeah.
But without failing, the fun part as well is that if you're ever on the Gold Coast, I am a body pump instructor. So if you feel like you'd like a bit of exercise after all this information, you can just fly on up to the Gold Coast. That's the fun fact here.
I just have visions of you with reading literature with one hand and just like giving it one of these ones with the other. Like, honestly, I can see it. I can see it happening.
Have you been in my house? Because that's what it sounds like.
That's awesome. I knew it. You're an absolute package. I've been thinking about it. Just hearing you say you're an emergency nurse. I'm an emergency nurse too. So, and the other thing as well, everybody who's watching, emergency nurses like to overshare a little bit. So you've been warned, okay?
That was a disclaimer at the beginning.
Yep, we're here. All right. So let's get into what we really need to talk about today, and that is, what is sepsis? So can you explain to all of us who are watching just what is it and how is it relevant when we're parents or families, when we're looking after little kids?
Yeah, absolutely. So I think first up, some of the things we might discuss might seem really, really scary, because sepsis is a scary condition. But again, the good thing about sepsis is if we recognise it early, we can really put a stop in those really adverse outcomes we may see for children that have sepsis. The big thing that I really want you to think about is that you can't have sepsis without an infection. So your child might have a chest infection. They might have a urinary infection. That might just be an infection that, you treat it, you have some antibiotics and it goes away. But sepsis is something that happens when a child has an infection, and it causes the body to go into this haywire response. And in turn, it starts to damage its own organs. We don't know why. We don't know why some more than others, but it's an infection that then turns into this overwhelming response that can be quite dangerous and deadly.
Right. Can I just say that is one of the clearest definitions of sepsis I've ever heard. Like, just being able to understand that, that it is having an infection, and then hearing that it's this body's haywire response to it, I think that just will really clarify that for so many people out there. So thank you for actually, saying such a clear, succinct understanding of what sepsis is. So now that we understand exactly what it is, I guess one of the main questions certainly that we get asked in our paediatric first aid classes and so on, when we do go on to things like, if we get asked questions about fever and infection and so on, is, what are the signs and symptoms? What as parents and families are we actually looking out for in our kids when they're sick?
Yeah. So I think, again, the first thing to keep in mind is because it can happen from any infection. So let's say it could be a bacterial, it could be a viral, it could be a fungal. Who knows? It happens all around the world. So depending on where you live, there's obviously different pathogens around the place. Yep. So because let's use a chest infection, because that's quite common in young children, isn't it? You might have a chest infection. So already they have a runny nose, a cough, maybe it's a dry cough, maybe it's a wet cough, maybe they're sleeping a lot because they're unwell. Those all could be normal symptoms as part of that infection, okay? Yep. But what we need to know really then is when something changes. The difficulty with sepsis is all of those symptoms I've just said could actually be signs of sepsis, or they could be the chest infection. So how do you know what the difference sort of is? That's where it's tricky.
Yeah.
I think what the big thing is one, when it changes, your child may have been unwell for several days. They're not really getting any better, or maybe they got a little bit better, but now they're getting worse again. That is a change in the condition. So they've had the same illness, they've had the same infection, but now something has changed. And the big red flags we think about are irritability, so excessive irritability. So yes, they're grumpy because they're unwell, they've got a fever, but it's just something to keep an eye on. And I think the big thing is, if you think about, I like to think about sepsis as a puzzle. So you've got all these little puzzle pieces that you're literally putting together to then say, oh, hold on, I think this actually could be sepsis. Okay. So, rattling some of them off: irritability, excessive sleeping. Maybe it's little things like they're not eating and drinking as much as normal. Decreased wet nappies, things like that. They're not acting their normal self. And depending on how old your child is, obviously that will manifest a little bit differently. So a really young baby, they might not be sucking as well when they're feeding as normal. And that one sign in itself, we can't say, yes, that's definitely sepsis. It may be a combination of those things. And then the really obvious things are things that we're really concerned about are like rashes, that when you press on them with a glass, they don't disappear. When you physically can't wake your child at all, obviously that's very, very big red flag. But then also things like shortness of breath. You can see their stomach moving in and out, and they're breathing really, really quickly, or they're breathing really slowly. You might hold them and you can feel their heart rate going fast and fast and fast. Things like that. Again, things that we're a little bit cautious of, and we'd really like to see those children to be able to start to hopefully put those puzzle pieces together.
Yep, absolutely. I find it really interesting what you're saying about that puzzle analogy, because a friend of mine, when she had her first child, she was only, I think, 8 weeks old. She put her down to sleep, noticed that normally she was one of those kids who just went to sleep from a very early age. It was just her. She cried every time that her mum laid her down. She tried feeding her, but she wasn't feeding properly. She noticed that she was breathing more rapidly than usual, and she just went, this isn't right. I actually don't know what's wrong with my baby, but this just isn't right. And she took her up to the hospital, and she ended up having sepsis. and she was hospitalised, and obviously hospital did everything that they did, and she's a teenager now, so she did all right. But what really stands out to me there is the fact that she didn't know the diagnosis, she didn't know a child had sepsis, but she knew that what she was doing was different to normal, and she trusted her gut and went and got help. And I think that those puzzle pieces are a great analogy, a great way to saying that. So one thing that I am curious about is that what are the risk factors? I mean, you talked about age there as well. Are younger children more at risk than older children, or are there other risk factors? What? Yeah, that's what I'm trying to say. Yeah, what are they?
I knew what you were saying. What are they?
Yeah, good.
So I think the first, again, there's some children and adults as well that get sepsis, and we have no idea why. So we can't quite figure it out. We think that there is some sort of genetic anomaly that occurs within the body, but that's the first disclaimer. So sometimes children get sepsis, we'll never know why. Mm-hmm. There are, though, if you think about it, it's an infection, the body's responding, that do put you more risk than others. So, for example, children that are immunocompromised for some reason. So children that perhaps you might have a child that gets sick again and again and again and again, and they're prone to infection. So obviously the more infections you get, the more chance you have of getting sepsis. Mm-hmm. But also more importantly to that is children that may be on chemotherapy, they may be treating for cancer, they might be treating for maybe some sort of like Crohn's autoimmune disease, that they're having to take medication to suppress that immune system. Yeah. They're less able to fight off an infection. So they're at risk. Aboriginal and Torres Strait Islander children are also at higher risk as well. Little tiny babies, so babies under 3 months old. Also, again, it makes sense. Their immune system is not as equipped as an older child. But then for the proportion of children that do have sepsis, it's in the less than 5 age group that we see it a little bit more. And that's also internationally as well as in Australia. And you think about it as, again, we don't know why, but they're a really tricky age group because they can't articulate and tell you, hey, mum, I really feel rubbish, or I actually feel worse now. Whereas older children and adults have been, historically documented to say, I feel really sick, something is not right, I just feel like I'm going to die. A 3-year-old's not going to be able to tell you that. And that's where we see the difference in what actually sepsis is. But I think as well, I might just add, those are the risk factors, and as well surgeries. Maybe you've had a surgery. So again, you're at more risk of an infection there. Maybe you've got a device in, something like that. But I think as well, really important, and I want you guys to know that we say it all the time, parents are the expert of their child, but what does that actually mean? But what it means is you are essentially the walking textbook that accompanies that child. So things that we as a health professional won't know about your child, you absolutely will. So when you're sharing that information with health services, you might say, look, this is going to sound strange, but my child is actually sleeping more. They just woke up from their sleep. They had a feed for, they had a little bit of food, or they had a feed, and then they've gone straight back to sleep, and they're just really drowsy. We might say, well, children do sleep a lot at this age. And you say, yep, but my child doesn't. This is definitely different, and this illness is different. They've had lots of chest infections before, but something's not right. And that clinical intuition that we feel, and we feel it every day in life, in our own lives. You might think, oh, I've really got to go to the gym. But your body's telling you, no, you don't go to the gym. You've got a jam-packed day. You're going to end in a tiz. You get to the end of the day, you've slotted the gym session in, and then you're a blithering mess because you've just overwhelmed yourself and you've done way too much. You should have listened to your gut instinct. Told you, no gym.
That's it. Yeah, you're exactly right there. But it's not an excuse either. So that's the thing. You should listen to your gut. But my brain might like to tell myself that even when my gut isn't telling myself that. But that's another story.
We'll talk about that later.
Yeah, we will. There's a difference between gut and motivation, but that's okay. But I think what you're saying there is one of the biggest things. I'm curious, if the people who are watching at the moment, do you trust your gut? when it comes to your children? Would you have the confidence that if you have presented to, say, an emergency department or your GP, and they're saying, to you, oh, but this is normal for kids, would you actually say, yes, but this is not normal for my child? I'm really curious as to that. So please, if you're watching now while we're live, please comment down below, because I'd love to know if you do have that confidence to do that. So yeah, just curious. Now, can we keep going with this trust your gut and also confidence thing, because I think this is so important. Now, I suspect I'm significantly older than you. I started nursing quite a while ago, but that's okay. And certainly,
I'm actually 17. This job's made me look like this.
Well, I'm only 24, so this is what, this is what night duty does to you after a very long time. So that's all right. I love night duty. I'd never do it again. Anyway, I digress again. Now, so what was I saying? I've lost my train of thought now.
Gut instinct and intuition.
Intuition. Thank you. Thank you very much. Okay, so just say, okay, your child's unwell. You've presented to ED. Okay, you've been there a while, they've been observing your child, for example, or perhaps you've been sent home and, because you've had, perhaps some kind of diagnosis, but then your child starts to get worse. So, or if you're in hospital and you notice your child they're not getting better. I know we expect kids to get better, but they're not. Things are getting worse. What can we do? What should we do as parents?
Definitely speak up. So I think definitely speak up to the nurse or doctor or GP, wherever you are, and speak up. Because I think what happens is we assess a child, everything makes sense. We're now treating a chest infection, but the clinician might think that we too have gut instincts, right? And it's based on previous experience. You can't put your finger on it. Same as a parent, you can't put your finger on it. But again, something's not right. So I might assess a child. This is what we're treating for. We're going to just give them a little bit of fluid and we're going to keep an eye on them. Yep. Now, the trap we fall into is thinking, well, we're out of the woods. That's it. We're all good. We're having some fluid, we're monitoring, and that's okay, and we'll go home. But the nature of sepsis, and again, if you think about an hourglass timer, is things move very slowly in the beginning sometimes, and it's all very non-specific. And then suddenly the sand drops and you have this rapid deterioration. So you may well be observing your child and something, again, subtly, even in a hospital, might change. Now, it's not that the doctors and nurses missed something. It's just this illness pattern was recognised as a chest infection, but now we're actually looking at something different, and that something different is sepsis. And those little signs that are coming out and making it glaringly obvious. If you don't speak up, obviously, the nurses or doctors might not come back for a few hours because everything is on track. But if you speak up and just, even if it seems like something really small, they can at least come and assess and say, oh, okay, yes, actually, you're right. This is actually now something we're worried about. And look at the child's heart rate. It's actually gone up. So signs and symptoms from a medical perspective may complement what you're seeing as a parent, which is your child's really irritable right now and they don't even want to be held. For them, again, that's not normal. So that gut feeling, you don't have to know the medical stuff. You don't need to know. You just need to know that sepsis does happen with any infection and that we absolutely want to hear from you as a parent. Don't feel like you're bothering us. We're there to help your child and you and get on the road to recovery. And you really are key to that. It's a team effort and we really, really value your input because you know your child best.
Yep, absolutely. That is so true. And that's where I was going with the being an old nurse thing, was that even, that long time ago when I was learning nursing, we always taught to listen to the parents and to trust our gut. And I think that is something that more and more and more that, clinicians are really understanding, is that it's a team. We are a team to look with you to look after your child. And that is so, so important. Now, what about prevention? So we've talked about how to recognise sepsis with the signs and symptoms. We've talked about the risk factors. We've talked about what to do if you're worried about your child, that they're becoming worse. But can we prevent sepsis at all?
So you can prevent it in the way that you would prevent an infection, really, because, again, you can't have sepsis without an infection. So whatever infection that is, that's the biggest thing. So in preventing the infection, so things like, obviously, hand hygiene. So, washing our hands before we're eating, all those basic things. If your child's got a wound, because this is one that really stumps people. You can get sepsis from a graze on the knee. So your child, perhaps however old they are out maybe learning to ride a bike. They fall off, they graze their knee, they've got gravel in it. It starts to look a little bit maybe not great in a couple of days. It's looking a bit ripe. If we don't keep on top of that cleaning, and even so, that is an entry point for bacteria, and that can also cause sepsis. So there has been children that have had sepsis from grazes. It's as simple as that. So keeping up good wound care, obviously vaccinations. We've seen an eradication of a lot of infections and really quite dangerous pathogens since the introduction of immunisations and vaccinations. So those things that, covering mouths when coughing, all those things that we've learned. And COVID-19 has taught us a lot about those things. So our hand hygiene definitely improved since that, that's for sure. But I think the prevention is also, this is a little bit out there, but your prevention is also in you guys spreading the word. So not going around terrifying everyone, but just saying, have you heard of sepsis? You don't need to know much about it. You just need to know, the basics, and then when to seek help. And if you're ever unsure about what you're looking at, going, something's not right. I remember some crazy lady talking about sepsis. I'm going to go to a medical professional, because knowledge and awareness is really power in beating this disease. And the more we know about it, the more we speak about it, the more we actually spread the word and normalise having conversations about it. People have heard about it, and then they can go and say, oh, excuse me, doctor, actually, these are the things I'm worried about. And you're giving a clear story. The doctor can go, okay, that actually does sound concerning. Let's look into this. And again, they're your ally.
Yep, absolutely. And I think that's incredibly important. And in saying that, while we're talking to you about this today, it can sound incredibly frightening. And I think some people may want to stick their kids in a little plastic bag with holes in it so they can breathe, so that they don't get anything around them. But it's not about that. It's not about that. The key to this is, if you are feeling frightened about what we're talking about, turn it around. You're armed with knowledge. You're armed with knowledge to know what to look for, and that's confidence. So you know that these signs to look out for, and I think that's one of the most important things. You're simply being armed with knowledge. And of course, we need to let our kids get out there and climb trees and fall off and graze their knees and eat dirt and do all that kind of stuff. But it's just about, being balancing and washing our hands with soap and water and cleaning a graze when it's there and so on. And that's the important bit. And the hardest part of parenting is balance. It's ridiculous. So that's one of those things. But remember, knowledge is power, and it's really, really important. So, yes, keep going. Go.
Think of something else. I think, as well, as scary as it may be, it's really important to also know, though, that if you get it early, it'll be okay. Yeah. It'll be okay. It's getting it earlier. It's getting treatment early. It's not a terminal diagnosis. If you get this early and you're clued onto the signs and you watch your child and just watch for little changes, or when something isn't quite right, and it's also okay to get a second opinion is the other thing. If you're not happy with something and it doesn't sit right with you, it is okay to go somewhere else. It's also okay that things might change in the matter of 3 hours. So you might have been sent home from the emergency department. You get them home. Now something still doesn't seem right. And again, something's changed again. So you just go back to the emergency department. No one's going to say, oh, they were here 3 hours ago. They haven't listened to our advice. Well, actually, no, this is why I'm back. And this is why I'm concerned. And again, it may be a matter of monitoring, or it may be a matter of actually treating straight away. But again, we can't do it without you guys. We can't do it without you guys. The earlier you come and get care and help, the better outcomes there will be.
Yeah, absolutely. And the good thing is that Children's Health Queensland have also, you have actually brought a pamphlet today that I think summarises everything beautifully, because I don't know about you, but when I was, I know that when I had my kids, my brain did not retain anything. So being able to have resources such as the new website is absolutely fantastic, which I will put their web address and put it in the comments below for everyone. But there's also this resource, which I thought was absolutely fantastic, which was, could this be sepsis with Queensland Health? Do you want to step us through this?
Yeah. So I think again, like we said, if you know the word and you just know that it's something that happens when you've got an infection that can be quite dangerous, you can ask the doctors and nurses this. Look, I've heard about this sepsis word. Could this be sepsis? This is what I'm concerned about. So using that language as well. But essentially a few things that I spoke about with the signs and symptoms are things that really you can use to come back to a hospital, or things that you might be at home and you might have, this is available on the website. So you might actually say, oh, hang on, these are signs I'm concerned about, which is, this irritability, things like seizures, for example. Child might not have had a seizure before and they've had a seizure. That's concerning and requires you to go to the hospital. So it's just an easy access document that at least will give you a bit more information. And you can also use it to track things and keep an eye on things if things are changing. So, you may have gone from 4 wet nappies a day to 1. So, well, that is a change, even though they're still drinking a little bit less, but maybe that doesn't make sense to you. So you can tick that box. You can have that information and go to the health service and just say, this is what we're concerned about. And children that are seen in emergency departments up here in Queensland, this information is given to them on discharge. So the doctors and nurses were treating for a simple infection. We know children get infections all the time. And 9 times out of 10, it's completely fine. It's the 1 time out of 10 where you need that knowledge. So you take this home, you keep an eye on it, and then you can go back. And again, you're all speaking the same language. These are the things that are different than 6 hours ago. And the doctor and nurse will go, okay, that's the information we need. What we're seeing, we're still not sure if it's sepsis, but changes in pattern are happening. So let's treat.
Fantastic. Yep, great. Now I'm going to pop that in the comments below as well. So, and of course, just even a quick Google about that, it will come up. It is, so don't worry. Make sure you save it as well, though. I think that's a really good thing to do, is save it to the files on your phone, so it's there. It's such a good resource to have. So I will put that in the comments below. Now, Jenny has actually said as well, what a fantastic resource. Jenny, I agree with you. It absolutely is. But in regards to what we were talking about before about trusting your gut and being able to say something, Jenny said that she has been able to say that. And I think that's a fantastic thing. I think often we can think, oh, the doctors and nurses, we're handing over our child to them and, oh, I'm a bit, they know what they're doing. They're the experts. But you know what? You're the expert in your child. You absolutely are the expert in your child, and that is the most important thing. So Susie has also commented. So Susie has said in the past she would never have had the confidence to question a medical professional. Now she's learned so much and will stand up for her child if something is not right. Knowledge is definitely empowering and life-saving. That it is. Well summarised, Susie. Absolutely. You are 100% correct. So does anybody have any questions for us? If you do, now is the time to pop them down below while we are live. If you're watching it as a recording, unfortunately, we won't be able to answer your questions. But if you're watching live now, and you'll know if you're watching live because it has live across the screen for you. So that's how you will know.
I need that information. That's good for me.
Yeah, so don't worry. You'll know if you're watching live because it says so. If you're not, you're watching the recording, okay? So don't ask any questions. We'd love to answer them, but we can't because Amanda's probably teaching a body pump class. So
we're not staying on Facebook all night long. That's
no,
my diary to answer more questions.
It's not good for our health to do that. It is not good for our health. Yeah, we have to. Boundaries with social media. That's also important. Okay. So looking around, we've got lots and lots of comments, which is just lovely. We've got lots of thank yous and great resources. So that is really, really great to hear. I agree. I think it's absolutely brilliant. what I'd love to do is just quickly tell everybody as well that I think it's in 2 weeks' time, I'm not going to tell you the date because I will get it wrong. I am actually going to be talking with part 3 of this series to a wonderful mum called Amy, whose daughter Mia had sepsis. And we're going to talk about her or the family's journey through that. And I've had the privilege of talking to Amy already. She's an extraordinary human being who, please come and tune in and watch, because you'll be captivated by her every word. And I think it's really important that every single parent and family hears their story. I really do. I'm going to leave it there because I want you to come and watch. Amanda, do you want to say anything about that? Because I'm sure you know Amy.
Oh, I think, again, the more we talk about this and hear about it and resonate with different people that have had these experiences, we say, oh, okay, I completely appreciate where that person's coming from. And again, because it's so sneaky, this illness, hearing from someone, another mum, is really, really important, because, you could save a life, get to a hospital early, and it's really, really good information to share and talk about it. And normalise it.
Yeah, that's right. This is something that we should be talking about. It's okay to talk about it, and we should be normalising everything that we've talked about today. It comes from care to all of that. Now, before we actually started talking about this today, I asked Amanda what her key messages were. What were the things that Amanda wanted you guys to know the most? So, do you want to share those now, Amanda, as we wrap up today before we go? Okay, tell me, go for it.
Now, there's a lot of them, but I've kept them brief, okay? So the number one is really trust your gut when something doesn't feel right. And don't worry that you don't know all the medical stuff. Don't worry about that. Your role as the parent to advocate is that gut instinct and that clinic and that intuition. I think the second thing is that you are a key part of the team in decision making. So as doctors and nurses, we really want to hear from you. We really want to hear your story. We really want to hear things that might not seem like much to you, but might be a really key red flag to us. So tell us everything. We want that information to be able to treat your child the best way we think so. I think the other thing is that you're the expert of your child, as we've said. And the key for sepsis is getting it early. So in getting it early it starts in the community. So 85% up of sepsis begins at home and comes through the emergency department. Wow. So with that in mind, you guys see it early. You guys see it way before us. So by you being aware of it, you're having a little bit of knowledge on it, and hopefully you've learnt today, you really are key to stopping sepsis. Medicine can only do so much, but without you guys, we can't do it.
Absolutely incredible. Amanda, I have learned so much today. I imagine that our audience has learned an incredible amount from you. Not only are you an expert in your field, you are so personable and articulate. It has been an absolute delight talking with you today. And I would love it if you could come back another time to do this again, because I think the more that we talk about this, as you said, the more that we get it out there. To be honest, it comes down to people being aware and being able to help save their kids' lives. And that's what this is all about. So thank you so much. Thank you to everybody who has tuned in. We will see you again very soon. And any questions that you do have, remember, we've got these resources down below. Make sure you have a look at the website, and we'll see you soon. Okay. Bye, everyone.
Bye-bye.